Assalamu alaikum, you're watching Views and News and I'm Faisal Rehman from our Islamabad studios. Today we'll be talking about the concept of this lockdown and the smart lockdown. Now the interesting part is that most of these countries, they have in fact given a lot of relaxation to their public, primarily by in fact having this smart lockdown condition imposed in a lot of bigger cities. So the case is with certain countries which are already opening up. For example, when we talk about New Zealand, we'll see that there is a lot happening out there as well. They have been able to control it. So the cases with China, for that matter, no new cases have been reported in the city of Wuhan, and so on and so forth. Even when you talk about third world countries like Pakistan or India, for that matter, things are in fact getting a lot better, but there are two school of thoughts that prevail there. One is about the situation that there are not much medical facilities or the test kits available out there. So primarily a lot of people who are in fact carrying this coronavirus, they are not in the list of the number of the total patients. So that is a very genuine concern, very important one as well. Then the second concept is that a lot of people might have had it earlier during the month of February or March, for that matter, and without showing many symptoms, or maybe they were asymptomatic. So the issue was primarily that maybe they have gone through this, but currently, since they are not positive, so that is another very important area. And third, in fact, that a lot of doctors do believe that maybe it is about the immunity of the people living in the third world country, because facilities, basic ones like clean drinking water, for that matter, or the living conditions are not that good. So primarily this is the main concern. But having said that, in certain conditions, when you have exceeded the number 21,000 as far as the overall diagnosed and reported cases are concerned, around 600 deaths have been reported, and now they talk about opening up or giving relaxation, or primarily when you talk about giving something like a smart lockdown. What is that supposed to mean? Because looking at the current scenario, it seems that the people are already out on the roads, purchasing, buying stuff during the month of Ramadan, and that is also a very important area, because you can't just keep the people 24/7 inside their houses. To talk about that, we'll be having a few very interesting guests, and obviously we will be talking to the concerned doctors, we'll be talking to the journalists, we'll be talking to the analysts also regarding this. But we'll take a short break here. After the break, we'll return and we'll continue our discussion. Welcome back after the break. To talk about the issue, we have been joined in by Dr. Rana Javed Asghar Saab. He is an infectious diseases expert. Dr. Saab, Assalamu alaikum.
Walaikum Assalam ji.
Dr. Saab, thank you very much for taking out your time and talking to us. Now, first of all, sir, now since we have also had an earlier discussion in one of our shows, and you were very, very pertinent, you were very to the point in that also, that this is what needs to be done and this is something which we should always avoid. Now, the government most likely, especially when we talk about Punjab, the largest province, they are giving this relaxation to the public, and that relaxation is called the smart lockdown. Earlier, we have observed that the lockdown conditions initially, maybe for the first maybe few days or a week or so, were actually implemented, but later on people started taking it casually. This is the habit, this is the general concept, this is what the human nature is all about. Now, sir, the conditions which are called the lockdown or the semi-lockdown or the relaxed lockdown, whatever you may call it, or the smart lockdown, what exactly is going to happen? Because sir, now we have realized that within the next 10 days, we'll be seeing the peak.
Thank you very much for taking me in your program. You're very correct. When we say smart lockdown, that should be then implemented as a smart lockdown relaxation or whatever it may be. It should not be a chaos. So there is a difference between when we say smart lockdown and relaxations and a chaos. So we need to avoid the chaos, but we need also to give breathing space to our public who need to go out to earn their living, who need to go out to buy their necessities. But it should, until we are sure that this is under our control, we need to be relaxing, but with very keen observation, making sure we are doing enough testing so we can identify a peak or a outbreak, a major peak in certain area, geographic area. But if we are not testing and people are taking it as routine or normal, that will be a major mistake, because this is still not a normal situation. And pretty much everyone now knows in Pakistan how many thousands of people are dying around the globe because of this disease. So we need relaxation, we should get relaxation, but that also, as a society, as a population, as a citizen of Pakistan, I think we all should have the responsibility on our shoulders.
So, Dr. primarily the social distancing, the SOPs which we have adopted, the kind of procedures which are in place, the protocols which are being looked upon in various ways. Few people say it's fine, few say that they're like now they've become a problem in their daily routine. I think this is something which is going to be a new social norm, let me put it this way, in the future, the social distancing, because the moment you get close to someone, you'll see that the other person is going to jump away from you. So this is something which is pretty interesting in a way, but this is a new norm. Dr. Saab, we have also been joined in by our MNA from Pakistan Tehreek-e-Insaf, Nusrat Wahid Saiba. Assalamu alaikum, ma'am.
Walaikum assalam.
Ma'am, thank you very much for taking out the time in talking to PTV World. Now, since a lot of people believe, it's been written in the papers, it's been talked about in the talk shows, that the government of Karachi has done a lot better. But there are various schools of thoughts prevailing out there as well. A lot of people believe that most of the people in the province of Sindh, primarily, they're not admitted in the hospitals or in the other centers because the conditions out there, they are pathetic. Let me put it this way. And not only about Sindh, most of the other areas of Pakistan too, by the way. Now, they are primarily under a kind of a house quarantine condition. Let's start off from there, ma'am, and also inform us about the condition and what exactly is going on out there in that part. Though the weather is pretty hot, initially we thought that this is going to curtail, but it's not happening.
Yeah, Bismillahirrahmanirrahim. Thank you so much for inviting me in your program. Actually, the thing is that whatever the government is doing, they are doing on paper. We have seen the situation. We have seen the amount the federal government has given to them, and whatever they have done to that money, nobody knows. If 1 billion and 20 crore rupiah have been given to them, and if they did buy something and make packages, even if that was 2,500 rupees package, it would be 36 lakhs packages. and where they have gone, nobody knows. So there, whatever they were saying on TV, on papers, and they are not coming out of their AC rooms, and they are not doing anything for their own people. The condition of the people are still that miserable, which they have been facing right from the very beginning. And the poverty in Karachi and the other part of the Sindh, it's too much. You know, in Karachi, people can survive a little bit, but in other cities of Sindh, like Tharparkar, like Kashmir, like Shikarpur, and other cities, their poverty is too much that I'm afraid that people will die more by hunger than by coronavirus. And you said that Sindh government has been doing well. I don't think so. They are doing well. Their health minister, you have seen, she is unavailable.
But she is not available, but primarily most of the work is being done by the chief minister, the chief executive of the province.
Yes,
so he is always there. Let's not say that he hasn't done a good job. He's an educated man who understands the details.
He is educated man. He is educated man, no doubt about it. But they, like previously, they have, you can say, wherever they have make their money go, this time also people can't see that money. That money is coming to them. Or
so primarily what you're saying, that whatever the federation has given them or the centre has granted to the Sindh government, that money has maybe vanished or it hasn't been utilized the right way.
Always.
Now,
yes,
secondly, ma'am,
right.
Since you are also the MNA from the party which is in the centre, now what we have observed, let's talk about Islamabad. I'll just give you one example. I think this is the city, you know, the model city in a way where you can do anything, you know, for example, starting from wearing the seat belts to making sure that there should be no tinted cars in the city. That's been done. So what I'm saying is that when it comes to implementation, primarily Islamabad is the city where we have seen the results now. But ma'am, unfortunately, during this lockdown or the smart lockdown, forget about Islamabad, I'm talking about general huge cities like Multan, Lahore, Rawalpindi, Karachi even for that matter, Peshawar, that people are not in fact following the protocols and the instructions which have been given to them. Yes, they are trying to avoid to shake hand or to hug, but that social distancing or that physical distancing isn't there. I've seen people sitting in chinchis, 6 of them, 7 of them. People are still outside the fruit markets in huge numbers. So that concept of the lockdown, I mean, that is not implemented in its true sense or the appropriate manner, ma'am. How is the government going to ensure that that condition should be implemented also? Because at the end of the day, it's about stopping the number from increasing. And this is not the way to do it.
Yeah, you're 100% right. But the important thing is that people are not educated. Whatever you have been saying to them or telling to them, they are not going to obey it because they didn't have something to eat in their home. So they came out. They came out for Nadra. They came out for relief food. They came out for any other thing. And they wanted to grab it and go back to their home. But while they are standing there, while they are, whatever they are doing it, they infected the other people or they get infected by the other people. They don't know that this thing which has been killing so many people in the whole wide world, they think that it's just a phenomena. It's just been created by some people and they are exploiting it. But the thing is that if, alhamdulillah, in Pakistan, the rate is very low and people are not getting that much. But with the passage of time, if this, in the beginning, you have seen that people were afraid, really afraid. They were staying home. They were not coming out. And if they are coming out, they were keeping distances and everything. But now they think that it's just a normal day thing. They have to go out and they have to work double. You know, in bikes, 2 people are sitting. They, in Chinchi, as you said, 4 or 5 people were sitting. They don't bother that they will get disease or anything. They want to get food. They want to get money so that they can run their homes. This is a very,
ma'am,
very
there are
situation.
reports that, in fact, 12,000 rupees is what has been allocated. And the functionaries, the people who are in fact, assigned this job to distribute this money. They are maybe giving 8,000, 7,000 to the individual. Rest, God knows where it is going. So there is a lot of problem. But let me get back to Dr. Rana Jawad Saab. Jawad Saab, couple of points here now. One is about the major issue of following the protocols and then the social distancing, physical distancing. Now Eid is also coming. We'll be entering the, we have entered the second Ashra of Ramzan, and then the third one is always a very busy one. People are out shopping for Eid and so many other, in fact, related activities are there that mostly kids, families, they're all out. Now, so looking at number one, the area of implementation, police cannot force. And secondly, when you talk about this vulnerable young, lot of people called the tigers, PTI tigers by the government, I mean, these people are not trained, they are not social workers, they are not scouts, neither they are the civil defense people. So what I'm saying is, don't you think that we are also making them vulnerable? Because when I saw them gathering together in huge numbers to listen to the speech of the Prime Minister, there was no, it seemed as if there's a classroom which should have maximum 50, 60 people, about 300, 400 were there. So this is one thing, you know, something goes wrong from the very basic. And secondly, sir, when you talk about the disease, whatever has been told by the Western world, the magnitude of the problem, is it that big? Or maybe it is just exaggerated? Or maybe there seems to be something else behind this?
Yes. I think you have raised very important points. And let's start with the social distancing or how the public will follow all the guidelines. And I think the first step should be the senior government functionaries actually following the same protocols. If a senior government minister or a government high-level person is not wearing mask, is not keeping distance, 6 feet distance with other people, while doing a press conference, while doing a press briefing or other events, then we cannot expect that this will trickle down to the public at the lower. So the biggest responsibility lies at the highest level of office holders, no matter who they may be. So number one is this. Number two is also the responsibility of citizens. Police cannot force those things, but if we are in a shop and there is people are not following social distance, I think we need to speak up, and every one of us, and says, you know, guys, keep a distance. Let's go inside the shop one by one. And the third point is actually it's not just about the poor people who are not following the social distance. I'm sure you have seen that clip where a lot of female went for the Eid shopping, for clothes shopping, and when the police came, they had to escape from the first floor back door of
Yes.
this
Cloth market,
so
I guess.
it's not just simple that only I'm fine with the poor man going out and finding a work for and food for his or her family, but I'm not fine for this, as I said, haphazard approach or chaos in which every one of us is doing whatever we may please. So we need to, as a government side, on the government side, I think it's the responsibility of the government and the citizens themselves to make sure that while the government is relaxing those restrictions step by step, we keep that spirit, and the government should also enhance testing of high-risk group and other people, so we know that it's not getting out, the situation is not getting out of our hand. Until today, I think we are doing better, but there is no guarantee. We have seen that in Singapore, in Japan, where they have flattened the curve in the beginning, they have gotten new problems now. So there is no guarantee, and we should be very careful.
So, Dr. Saab, one quick comment before I go to Karachi and have a word with the lady out there. Just tell me that if one person gets it, there were 2 or 3 cases, one in Japan, I guess, one in Singapore, if I'm not wrong, that one person was COVID-19 positive, and certainly when he got cured, he got it again. So, even the antibodies, if they are present inside you, still you can get it, right? And is it also true that the one which we are having in Pakistan, maybe I do not know the right and the technical word for that, but the overall strength of that virus has eroded over a period of time before it started hitting people in Pakistan?
Actually, you are correct that there have been some instances in which the person who has been tested negative a couple of times was later tested positive, and WHO is investigating these kind of reports. But until now, the consensus is that this may be due to a faulty test or the problem in the test, then the reinfection issue. But the other point is also correct, that until now, again, WHO has said we have no confirmation that once you have this infection, you won't be able to have another infection. So this has not been proven also, because in around 30% of in a study, in people who are tested positive, later when they tried to identify the antibodies, which shows an immune response to an infection, 30% of those previous patients either didn't have antibodies or very little value or number of those antibodies. So this is also a fact. Your other point, that does the virus has mutated, that it has become less say dangerous to the population in Pakistan. That has not been proven either. Even actually today, people have looked at the genome across the world, around 5,000 of its samples, and they have figured out, yes, it is changing. Like all viruses, it changed over the time, but it's still not has changed significantly in its properties of infecting others. The reason in Pakistan or India we are having better outcomes until now may have something else to do with it instead of virus virulence. So, and people are speculating a couple of things, and one is, as you also mentioned, some previous vaccination, like tuberculosis, which we all get in our childhood. Some are coming up with even the polio vaccination benefits. And the third one, which is coming up, is the weather, the change of weather. In US, and this is just what you say, hot out of the press, that top scientist who's working on this COVID in US has today told me that as the summer is heating up in US, the infection rate is dropping, and it's now with each degree, 1 degree Celsius.
Because of the lockdown, sir. Because of the lockdown, because the infection rate, because look at Karachi, the temperature yesterday was hovering around 41, 42. But when you talk about the number of cases, they are still multiplying out there. So we will get back to that, because there are so many various angles attached to it. Now I'm talking about the city of Karachi or the province of Sindh. Now there are two important areas I think one should talk about. One is about this issue of 18th Amendment, because when you talk about the medical facilities, primarily it has become, the assignment of the provinces now after the implementation of the 18th Amendment. Now center is taking other measures, whereas the province is taking something else into consideration. You're talking about smart lockdown, Sindh is talking about complete lockdown. I mean, don't you think this is so confusing, so conflicting, that even if Sindh really wants to implement lockdown, the proper lockdown, they won't be able to, because the rest of the country is enjoying the smart lockdown, which isn't a lockdown as such? Yes, Ms. Wahid.
I couldn't hear you.
All right. Doctor, would you like to comment on this?
Your last word.
Okay, yes, ma'am, go ahead.
Yes. Yeah, you were talking about the smart lockdown and whatever is smart lockdown. It's I think it's much better that we have a smart lockdown, and in this we have to teach our people how they should behave at that time. And the important thing is that the grocery shops and the vegetable shops, they should be open 24 hours. So there should be not a rush in that shops. Otherwise, people flock in that area and want to get the thing. So this, if we will think about it, that we will make lockdown, but it should be relaxing for the people, not for them that they will be in tension that, oh, we will get that thing or not get that thing. So this is very, very important. Whatever restriction you are putting on people, you should think about their condition, their physical condition, their monetary condition, and their availability. People cannot be available all the time on the roads. but they should make things like that, that it should be easy for them. It's not that we are making their life more miserable, because this lockdown has made it worse to those people who are earning on daily basis, those who are earning very low income. Their life has become very, very, you can say, vulnerable. People are dying. They are doing suicide just because they are hungry. One cannot stand this hunger
Ma'am,
anymore.
I'm
So
serious,
we
ma'am.
have
When
to
you say
take
that
care of
educate
all.
people, you can't just educate them overnight and under such crisis. This is the human nature that there's, and most of the people, since you hail from Karachi, and I'm talking about certain areas in Karachi where one room is being shared by 4 people if they are working on daily wages or something of that sort. I mean, this is a very common phenomena. How can you control that? Because that is something which seems to be an impossible task to accomplish, basically. And secondly, when you talk about, ma'am, people that they should not go, I mean, there could have been a certain arrangement that, for example, Tuesdays, Wednesdays, only women can go out and do shopping. This age group, elderly, can go on a certain date or during certain time periods. I mean, this could have been done. The smart lockdown could have been thought well, very
We
smartly
have to
actually,
think about
but
their
wasn't done well.
yes.
Yes, ma'am, please go ahead.
Yeah, which I was talking, that we have to think about their, for their ease. Whatever they are doing in their life, they should be a little bit easier for them, because as previously I told you that on daily basis, on other things, they are so much deprived of uh, the food, the basic necessity of their life is not being provided to them. In Karachi, I can tell you, we are MNAs and MPs, they are working like 24-hour clock. They are providing food to their doors. They are providing cooked food, packages, cooked food, everything to their home. And but we are not in federal, we are not in the power in the Sindh. So Sindh government has to do something. They have to provide relief to these people. I can't hear you. I'm
You
sorry.
know, I wasn't talking actually. But anyway, thank you very much, ma'am, for your compliments. Now, talking about Dr. Saab, 3 points, very genuine concerns. And now, since we're talking about, let's give the example of the province of Punjab. Smart lockdown, largest population, very vulnerable. Look at Lahore, look at other cities. Whether you talk about the temperature change, yes, sir. When you talk about the south, it is getting warmer, but you can see the weather out here in Islamabad and the upper parts when you go towards north. It's been raining, it's been very pleasant. Still, numbers are rising. My point is, sir, is now when you talk about the peak or flattening the curve, primarily when it goes up, hits the peak, and then like a product life cycle, basically. So that stretch or the peak, how long can that stay, sir? And under the given circumstances, whether the vaccine is arranged after a year, by the end of this year, or maybe the next year, what sort of a situation do you see around you, sir, during such conditions primarily?
So the one thing we need all need to be clear on, and this is being discussed on television channels again and again, that is Karachi has more number of cases, or Punjab has more number of cases. So which is doing better or not? So remember this thing: having more reported cases does not mean having more disease. Actually, I will salute those Department of Health who are testing more to find more cases, because once you try to find more cases, you're going to find more cases. Your number will go up, but that will help you to devise effective control strategies. And the question about even the flattening of the curve, or where we are on the curve, we can't tell unless we have enough testing, because if it's just like a jigsaw puzzle. If you don't have like 50% of your pieces with you, it will be very difficult for you to make that picture or make sense of what picture it may be. And think about the situation when you may have like 10% and 20% of the pieces, then how come you come up and assess the situation? Similarly, in any outbreak or pandemic, you need to know maximum number of cases. So all those cities or provinces who are trying their best to increase the testing and then show increase in cases, that's a good thing, and we should not discourage that. On the Islamabad issue, Islamabad has done a lot of testing, but we still have a lot of cases. I think in last 24 hours we got like pretty good number of cases more. We need to find out, are they linked to each other? Are they, are saying at random cases, but no, there will be fewer random cases, but most of these need to be identified to which cluster they belong to. And for that, you need people trained in contact tracing who follow up with these cases and try to figure it out from where they got the disease. So that's the one thing. On the smart lockdown, especially in Punjab issue, I think there are some concepts which look very good on paper, and there are as they say, there are many slips between cup and the, a lip. So the way they are implemented will tell us, is it a smart lockdown or it is, no lockdown. So we need to wait and see, and hopefully, but for them also, for Punjab also, they need to increase their testing to like 3-4 fold. They are, yesterday, I think they had like 5,000 tests done. This is for a province like Punjab is very small number. So they need to enhance this testing to implement smart lockdown. Smart lockdown
we've also seen even in countries like India, they have got these small mobile units, and they're just going into various bazaars and various markets and various areas where they're doing the random sampling. Now, that is also very important. But Dr. Saab, anyway, thank you very much for your comments. And now, when we talk about the issue between the center and the province, it is there, whether we believe it or we don't. When you talk about the province of Sindh, I remember the center was still thinking and maybe a little confused what to do at that time when the government of Sindh decided that they will close all the schools. So they, in fact, did. And then they went a step ahead, and then they went after the colleges, universities, markets, and so on and so forth. So they were the decision makers and the people or the group of politicians who, in fact, took the initial charge. And we can't take that credit away from them. We have been joined in by Ahmed Qureshi Saab, who's a senior journalist. Ahmed, Assalamu alaikum.
Walaikum salam, Faisal. Good to be with you.
Yeah, thank you very much, Ahmed, for taking your time out and talking to PTV World. Now, Ahmed, first of all, sir, since you write about it, you talk about it, I've done a program the other day about Kashmir, for that matter. And this current lockdown is already there. That's been prevailing. But thank God that things are not that bad out there when we talk about IOK, because this corona hasn't done much damage because people were already indoors and they had no exposure. But sir, as you move towards this side, we've also noticed that not many cases have been reported in Gilgit-Baltistan or Kashmir. So as you come further down, the addition starts off. And now it is believed that this is not only going to, in fact, really give a very tough time to the major economies of the world, but the general public is not safe. Now, Ahmed, there are two different approaches. One says that this is actually a huge issue and getting out of control. Others believe that this could be a conspiracy theory, maybe Bill Gates is involved, or the Illuminati concept is looking after this particular issue, or maybe in particular this is the end of time. Few of the very known anchors have done shows on that also and tweeted about it and even, uploaded their comments. Now, first of all, your take, sir. Where are we heading? Is this going to be a new normal in our lives?
Definitely, Faisal. We'll have to, I think all of us and all of humanity is adjusting to this new thing, and not just in terms of it being a pandemic, but also in terms of how we go about our lives. And I think I was just doing some research a couple of days ago on the oil crisis, for example. And during that research, I came across things or very important people who know things and people who follow things, who were saying that maybe we will never go back to a complete and full normal. there are things now that we're doing that might stay with us for a very, very, very long time to come. For example, social distancing. For example, the way restaurants operate, the way we do our meetings, for example, how we've been introduced to video conferencing and meetings over that. So lots of things probably have changed and will change. I really don't believe in conspiracy theories with regards to this, but Faisal, humans, whenever we have major things happening, conspiracy theories do come up. But I think it's a very clear thing of a pandemic. It's not happening for the first time in the history of humanity. We've had pandemics before throughout history. This time we all know what happened. It started from a certain city in a certain country. It spread rest of the world. We initially in Pakistan were safe. We did not get the pandemic initially or the initial infections through China, thanks to the good measures that the Chinese government initially took, and then the Pakistani government also took. For example, we did not take back some of our students who were in China. We shut down the flights to China. Many of the Chinese engineers who were working on CPEC and other projects in Pakistan, initially the Chinese government did very well by stopping them and let them stay home inside China because many of them were back for the Chinese New Year. So initially we were safe, but then of course, I don't want to go over, discuss the spilled milk, what happened initially with the infections coming. Of course, our neighbor, Iran, unfortunately, they went through very, very difficult time with becoming the epicenter of the pandemic in this region. And initially, of course, I think whereas we did very well at stopping the pandemic moving into Pakistan from China, probably we were not ready for what happened at the Pakistan-Iran border. But that's in the past. I think our government and I think overall we've done quite well in containing it and in dealing with it, although we were not ready initially. But now, of course, I think we're adjusting. And I like very much what you just said. We need to give credit where it's due. Initially, the government, the provincial government of Sindh, acted very decisively, and initially, of course, there was a little vacillation or indecisiveness at the federal level initially. But we moved forward, and I think we will continue, Faisal, with this debate over smart lockdown or whether we should have a complete lockdown. And we see many of our physicians and doctors and medical associations actually advising the government to go for a tougher lockdown. And I personally, Faisal, believe had we gone for a tougher lockdown initially, maybe even somewhere close to a curfew, I think initially for the first maybe a month, we might have been now today at the same place where, for example...
Ahmed, my question is, there seems to be an absolute disconnect between the provincial government and the center. One is talking about the smart lockdown. The other one is talking about the absolute lockdown. Absolute lockdown is not being observed. Smart lockdown is like a daily routine. No social distancing, nothing. But last quick comment, sir. You said that this condition, like a curfew, could have been imposed. But now, sir, we are either at the peak or we getting towards there. And we do not even know, because of the lack of testing facilities, that how many have been disturbed and where exactly that peak is going to be, how long that peak is going to be, when it is going to finish. But at that time, when the Eid is also approaching, you will be entering the last Ashra of Ramazan. The problem would be, sir, that a lot of people would get affected because the relaxations are there when it should have been a curfew. Your take, last point.
Yes, that's 100%. I mean, the Prime Minister expects the peak to be around the mid of this month. So, but nobody really knows exactly when it will be, but it will be at some point during this month. And I think we're beyond, Faisal, the point of enforcing a complete lockdown or something similar to a curfew, because the time for that was probably a month or so ago. Obviously, the government knows that if the situation goes out of hand during this peaking of the cases, then probably we will have no choice but to go for a situation similar to a curfew. And I think the NDMA and I think the Command and Operations Center know this, and I think we're hearing them and they're ready for this. if the situation gets out of control, they may go for something close to a complete lockdown or maybe even a curfew. But that's a last option. But I personally think the time for a complete lockdown or curfew probably was a month or so ago, and we should have gone for that then. I think it's quite difficult now to get the people back inside their homes, because there was a time when, Faisal, you know, and all of us know, when our people were inside, many, at least in the main cities, and they were ready to listen to whatever the government would have told them, and that was the time for a lockdown. We're beyond that now. Let's pray and hope that we don't get to a point where a lockdown or a curfew becomes necessary.
Thank you very much, Hamid. And people should also be very concerned that if there is this first wave of this virus, there could be another following it, and there could be a third one, just like a tsunami, number one, number two, and then the major destruction. So stay home, stay safe, look after yourself, wash your hands as often as you can. Do not touch your face, your nose, your eyes. Precautions, that is the only way. And I hope and I pray that things do get settled down as soon as possible, and we should have a good Eid. Anyway, that's all we have for this. I'll see you inshallah. Till then, you take good care. Khuda Hafiz.